Hello, my name is Isis Ashford, and I am the co-founder and COO of Greens Health. And I want to introduce to you Layla and Alicia. Layla is 13 years old with dreams of becoming a doctor, being reared by her single mother, Alicia, who works two jobs just to make sure she can put food on the table. The only thing that's stopping Layla from reaching that dream of becoming a doctor is her constant readmittance for DKA, also known as diabetic ketoacidosis. This is when the patient no longer has active insulin in their body as a consequence of being diagnosed as type 1 or type 2 diabetes. Layla and Alicia are not the only ones experiencing this emotional turmoil. There are 244,000 other patients that experience this on an annual basis, costing health plans $30,000 per admission, making this a $6 billion problem. What is obvious is that patients are not taking their medication. What is not obvious is those invisible barriers that stand in the patient's way, like not having transportation to make that doctor's visit to refill that prescription, or not having transportation to go to the pharmacy to pick up that insulin, or not having consistent housing to store and refrigerate that insulin. And the current standard is that there is one community health worker for 500 members, not making this a scalable opportunity. But that is where Greens comes into play. We integrate with the user's CGM or BGM. We then do a social needs screening, identifying what those social need care gaps are, or transportation, or even medication adherence gaps are, by using motivational interviewing to send those insights to case managers to provide that just-in-time intervention, and then enroll not only Layla, but the family into a family-based diabetes intervention program. And we reinforce those positive behaviors through our anonymous social compliments. And unlike the physician that gives that 15-minute conversation in the doctor's office, or the community health worker that's knocking on each door, we live in Layla's pocket so she can have access to us whenever she needs. And we know that this works because we have doubled medication adherence, where the current standard is 30%. Our population was 76% adherent to their medication. And it's no surprise where we have 84% engagement in our social compliments. And unlike our competition that has fragmented data sources like social needs screenings and diabetes management, we provide a full-on holistic and comprehensive solution to look at the whole person. And we are starting in the $8 billion child diabetes market with the opportunity to grow into the $62 billion diabetes market. And our business model is simple. It's $50 per patient per month for enterprise clients. And our technology has been vetted by the National Science Foundation, where we were able to build our MVP, and we are currently on our version 3. We've completed 2 pilots with 3 letters of intent from 3 different health plans, and we have strategic investments from 450 Ventures and $800,000 in investment raised. And our team is phenomenal. We are accompanied by my badass co-founder, Keelan Swain, with previous experience from ex-NASA and Intel, has been the lead researcher on 3 government contracts and grants, and we have 30 years of healthcare experience by our advisory team. The reason why I am so passionate about this problem is because my father was diagnosed with type 2 diabetes during the pandemic. And one conversation that stuck out to me was with his nutritionist, where she told my 65-year-old Black father from a small town in Mississippi that he should stop eating meat and start eating kale. He looked at me and my husband like, what the F is kale? And it's those types of insights that we're trying to remove from healthcare and add in empathy with a layer of cultural competency. And we are Greens, making every exchange inclusive.